Have you ever walked out of a GP appointment and sort of feel like I've left with nothing? So you've got like a whole host of symptoms, but the bloods have come back completely normal, and the GP says, well, you're probably too young for menopause. You're not alone if that's true. And a 2023 Women's Health study found that dismissive attitude is one of the top 6 reasons for poor menopause care in the UK. Into that gap stood the $60 billion industry, which we now call Femtech. So let's have a chat about who's actually benefiting. Can an app actually detect perimenopause? Perimenopause is where you get fluctuating estrogen levels, so you can have a spike and a crash in the same week, and that's why it's particularly difficult to diagnose. So wearables can track your heart rate variability, your temperature variations, your sleep fluctuations, and resting heart rate, and these shift hormonally, and that's really valuable, and it's also science. What they're not doing is measuring your actual hormones, so estrogen and progesterone, and so when they tell you that they're showing you hormonal fluctuations, it's what they're inferring from the data that they have rather than them truly measuring your hormones. Even look at that nice guidance for perimenopause, it very much diagnoses it based on symptoms and not, for example, the FSH levels. And so apps must think about perimenopause in a similar way. 2023, a randomized control trial looking at menopause showed symptom tracking improved physical and emotional outcomes. So let's get down to it. What are we really saying here? Use an app. Do track your symptoms. If it's monitoring all of those variables, brilliant. Have a look at them over time. Bring them to your appointment. The app isn't going to diagnose you, your doctor is, but they can work together to improve your outcomes. Most women have had a really rough experience of GP appointments. It's difficult when you know you're going to have a reduced period of time to describe your symptoms in a level of detail that really reflects what you've experienced. And I think that's where the opportunity lies, because turning up with data, so for example, I've seen patients who've brought in maybe 2 to 3 months of data that they've tracked on an app, is actually really helpful. And the reason I say that is, as doctors, we very much look at trends. So the one-off beeping high heart rate on your watch or device isn't really valuable for us, and it isn't something that you should worry about either. But looking at those trends over time can be really valuable. So who's making money off my perimenopause or menopause data? So Femtech is a $60 billion industry. Menopause or perimenopause is heading towards 27.8 billion. So you can see there's a reason why they are investing serious money, because it's generating serious money. So it's growing at about 16% every single year. Only 4% of healthcare research and development has been aimed at women, and that is why we're seeing this huge explosion of investment into this area. Your data is essentially funding the algorithm, the advertising, and sometimes even the sharing with third parties. If you haven't heard, in the news last year, the app Flow shared information with Google and Meta, and for that reason they settled out of court for $56 million for having shared people's menstrual data. This is one case we know of. We know there'll also be many more. You're sharing some of your most sensitive medical, personal information within an app. So things like your mood changes, your sleep, your libido changes, irregular periods are all going out onto these platforms. That's not general wellness data. It's not something that can be shared with teams who are just going to give you generic advice. It needs to be tailored for each woman, and I think we're seeing that definitely within mainstream healthcare. Like, there are no 2 women the same in any clinic with their symptoms or the support that they need, and we're looking much more at treatment options that are individualized and tailored, and apps need to be doing the same. So some things you want to consider is, how are they handling your data? Like, what's in their privacy policy? These are classically difficult to read. They're very boring. Most companies know that you don't read them, which is why they get away with exploiting information. You want to know if what the information that they are using in their algorithm, because for many apps, their algorithm is based on certain credentials. They're not using all of the information to make it more personalized for you, but they're collecting it anyway. Your body is not the algorithm, so you should never feel like you're trying to adapt to an algorithm in an app. The algorithm is there to give you hints and tips about what could be happening, but for many people there is a discrepancy between what the algorithm predicts and what you experience, and it's really important to be mindful of those things. And then She Ranked is a platform where we independently assess women's health apps against 5 main criteria. So medical integrity, data privacy, user accessibility, like is it suitable for all types of users and their requirements? Is it ethically designed? And also, is it going to help your health behavior for the long term? And so you can access those reviews for free. And it means once you've seen the mark, the She Ranked label, you can trust the app. My app says it's anxiety. Could it be perimenopause? Yes, it can be perimenopause. Anxiety is one of the most common misdiagnoses given for women who are in perimenopause. In fact, when I think of people that I've seen in clinic that were perimenopausal, they often come in thinking they're having some sort of mental breakdown because their hormones are all over the place. Their mind is foggy one minute and then sharp the next minute. And for a lot of women, they feel, especially if they're particularly young, that they're having some sort of mental breakdown. In actual fact, it's most likely perimenopause. So yeah, I would never trust an app to make a diagnosis of whether it's anxiety or whether it's perimenopause. I mean, have a look at the app, but if you have questions, then you definitely need to go and see your healthcare provider. 2023 Journal for Women's Health found that women had to see 3 healthcare providers before they received perimenopause diagnosis. NICE guidance says it's a clinical diagnosis. You see the symptoms, you diagnose the condition, and so be mindful that you do not have to wait for hormone tests or any other sort of testing to come back to get a diagnosis of perimenopause. Also, the most common reason for not being diagnosed with perimenopause was that you're too young. And I think within women's health, what we're seeing now is that a lot of these conditions where we thought there were age-specific relationships to a certain condition, some of those are being blown out of the water at the moment because we are finding women at different ages presenting with the symptoms. There are certain missed symptoms that appear for women in perimenopause, and I'm going to pop a list up here so you can see them. But it's things like heart palpitations, joint pain, brain fog, tinnitus, feeling like your skin's crawling with like insects, not very pleasant, or burning sensations, or a burning mouth, sudden onset anxiety, or changes in your body odor. The problem with most apps is that they are built for women who have regular cycles and are of reproductive age. And of course, when you're heading into menopause, those things will go out the window, especially the regularity. And that means for many algorithms, they aren't able to genuinely predict individualized feedback for you or the level of accuracy that you would need to make meaningful decisions about your health. So the apps don't really have a perimenopause lens. They'll just track all of the information and they'll keep it, and occasionally they might provide you something useful, but there isn't going to be sort of information there that you can truly rely on. So if you're over 45 and you have any of the signs of menopause plus that missed list of symptoms, then you don't need any sort of blood test to be diagnosed with perimenopause. If your GP says otherwise, then that's worth challenging. Is the Aura ring worth it? So the Aura ring costs about £300 plus a subscription, so you're not going to want to miss this. What it does well in perimenopause is it tracks your sleep, so it does like a longitudinal study of your sleep. So rather than you say going into your GP, oh, I'm not sleeping very well, with an Aura ring you'd be able to look back and watch that sleep declining over time, and that's actually valuable. Aura ring is now partnered with MIDI Health, which means that they are trying very hard to take the information that they're collecting and make it meaningful for women's health. Within sports medicine, only 34% of the research is based around women. For many of these devices, when they started, they were built around male data. That is improving, which is brilliant. So for example, Apple Health have linked up with Harvard to try and look at women's health in more detail. Whoop has also tried to link up with clinical institutions to really drive forward the collection of women's specific data, and that's a really exciting space. The only thing I would say about that is any perimenopausal data is still very much in the early stages, so there isn't much there that's going to particularly inform women at this point. I think where Oura Ring can help is if you feel like you've been repeatedly dismissed by a GP, to be able to go in with the data that shows the changes in your sleep cycles or your irregular menstrual cycles is objective data, and I think that's valuable. But if you're wanting to monitor things just like hot flashes and other symptoms, there are other free apps that you could do that on without spending the money. Obviously check ones that are protecting your data, not exploiting you, but there are other options. Overall, don't allow the industry to tell you that spending more means that they're caring more. It's marketing. Spending more on a tracking device does not necessarily equate to better health outcomes. Is Femtech actually changing the gender health gap? You will probably know the stat that women were excluded from US research trials until 1993. That's actually really not that long ago. So research into women's health is really very new. At its very best, Femtech is collecting data on women's health at a huge scale in a way that medical boards can't because of the restrictions. There are certain platforms like Oura, like Whoop, like Apple Health that are now integrating what they do with medical institutions, and I think that that has a real potential to shift things in terms of women's health. The Lancet in March 2024 acknowledged that there was a complete lack of education around perimenopause and menopause, and not just by women but by medical professionals and healthcare professionals. Now that we've acknowledged it, it has to move forward. I think for many years women just grinned and bared it because they were dismissed for it. Now it's been said out loud, it's out in the open. Everybody has to improve, whether it's mainstream healthcare or health technology. 2024 data found that 80% of US OBGYN doctors were undertrained when it came to menopause. And women's health journals in 2023 within the UK said that women were still very much being dismissed. The data gap is closing, but the training gap is not. Now, the other side of the coin is that the Lancet also highlighted that commercial companies within health technology were also over-medicalizing menopause in order to sell products. And how they did this is they tried to say that menopause is estrogen progesterone deficiency, like it's a disease or a pathology rather than a natural process. So health technology is a system that's designed to, it's incentivized to make you feel broken. So my job is to tell you what's a symptom worth treating and what's one that's just being monetized. What should I actually look for in a menopause or perimenopause app? So the 3 questions to ask yourself are this. 1, does it track the full picture? 2, where does the data live? And 3, can I export it? So does it track the full picture? You're not looking for a period tracker here. You're looking for something that's looking at your mood, your libido, irregular periods, the type of bleeding, any sort of stress, palpitations, anxiety. If it's got mood and the mood is expressed as an emoji, it's not the right app. So the second one, where does the data live? Where possible, you want the data to be stored on your device. You don't want it to be stored on the cloud. If you're not sure, of course, you can spend time going through the whole privacy policy, but you can also find the app over on sherank.com where we've checked the medical accuracy, the privacy policies, and all those other criteria to make sure that you're safe. In that, you want to make sure that they're not selling to any sorts of third parties, whether it's sales and marketing teams, legal teams, employers, insurance companies, possibly particularly insurance companies. So again, you'll find details over on the platform. If the app is free, know this, you are the product. So you want an app where the data can be exported either in a PDF or you can download it in another format. 80% of what is discussed in a consultation with your doctor is forgotten. The statistics tell us that, And so it's really important for you to bring any sort of evidence that you have. And also, if you want to, ask your doctor if they can provide a summary of your symptoms or of your consult that you can take away. So some names worth knowing. Balance app is one that we have reviewed, which scored well. It is for menopause, perimenopause, and it has direct links to Dr. Louise Newson's clinic. If you haven't heard of her, she specialises in menopause. And so we liked many aspects of the app. By all means, go and check it out. No app replaces a clinician or a specialist. It's worth knowing key places you can go. Know that if you're not happy with your first consult with a doctor, ask for a second opinion, ask to see another doctor. Know who the specialist organisations are that you can access. For example, the British Menopause Society, they have a full directory of doctors who specialise in menopause. And the Menopause Society in the US, it does the same. You don't have to accept, oh, you're too young, oh, it's anxiety, oh, it's stress, oh, your bloods are normal. If it doesn't feel right to you, it's not right. So 3 things I want you to leave with from today is 1, your symptoms are real. Whether it's hot flashes, whether it feels like anxiety, whatever it is, if it's there and you've got it, your symptoms are real, they deserve to be believed. Number 2, the system created this gap. Women weren't being served by mainstream healthcare, and Femtech is stepping in to try and fill the gap, but it's not problem free, and there's a lot being done in the dark. Some of it genuinely does help, but some of it is also manipulating a very vulnerable group of women who need help, and they are using that to monetize. And the last thing is, nice guidance says symptoms are enough. You deserve to be believed. And for me, the app is a tool. You're the expert in your own experience. Hope it helps.